This is a framework for assessing scrotal pain, starting with acute or painful versus chronic or painless. Acute situations tend to come on suddenly and cause severe pain, sometimes even waking you from sleep, and those are urgent assessments. Think things like testicular torsion. Chronic situations typically happen more gradually, have minimal or no pain, and involve progressive swelling, and they usually require a routine assessment. Hydrocele is an example of that. Transillumination, where you shine a light through the scrotum, helps tell if it's fluid-filled or solid. And location matters too. Something inside the testicle is a bigger concern than something outside of it.
These are the surgical emergencies. Testicular torsion is a sudden, severe pain with an absent cremasteric reflex and usually requires urgent surgery. Epididymitis is more gradual and associated with fever, while torsion of the appendix testes is less painful and often shows a blue dot sign. Finally, trauma to the testes is typically caused by an injury, and management should be based on type and severity of injury.
For chronic and painless scrotal swelling, painless lumps can be caused by several things. A spermatocele, or epididymal cyst, is a smooth, distinct lump typically found above or behind the testicle. Hydroceles are soft, smooth swellings that surround the testicle. Both of these are usually painless and have positive transillumination. A scrotal inguinal hernia is a swelling that occurs from the inguinal canal. It can sometimes be pushed back into the abdomen, and usually there's a cough impulse present. A varicocele can be described as a bag of worms feeling in the scrotum, and it feels above the testis. It's more prominent when standing and is most common on the left side. Testicular tumors, however, are painless, hard, irregular lumps, and they have negative transillumination. That's an important distinction to be aware of.
The most important point is that testicular torsion is a time-sensitive emergency. Surgical exploration must happen within 6 hours to save the testes. If the diagnosis is unclear, assume torsion until proven otherwise. Surgical exploration must occur within 6 hours to save the testes, and that imaging delays should not delay surgery if the diagnosis is unclear. The most reliable clinical signs include absence of the cremasteric reflex, a bell clapper deformity, and sudden onset of pain. The management pearl is that time is testes. Every minute counts, and when in doubt, explore surgically.